The laying of the foundation stone for the construction of a new health center in Nyamanari is spearheaded by Alpha Balde, a UK-based native of the community, who was financially supported by Chris Baylan. This is a landmark community-driven initiative geared towards bringing healthcare services to the doorstep of the people of Nyamanari and surrounding satellite villages. Access to health facility has been the biggest challenge affecting people in Nyamanari, with the community encountering many health problems resulting in child mortality, maternal deaths, and other related issues due to a lack of timely intervention in accessing healthcare services. The elders of the community, including the Alcalo Cherno Kande, and the women couldn't hide their excitement, disclosing how the health facility will open up Nyamanar as well as address all the difficulties people experience in accessing healthcare services. They commended Alpha and his partner for bringing the much needed facility to the community whilst assuring their continued support and collaboration to ensure the project's success. The project coordinator, who doubles as the proprietor of the health center, Alpha Banle, said he is driven by challenges the community encounter in accessing healthcare services while he was growing up in the village, citing maternal death, child mortality, and other issues as the key motivation for the health project.
This has been a continuous issue, whereas we lose a lot of people. So during this period, I thought part of my long-term goals was to give back to my community. And in that regards, this has been my main reasons why I brought up this initiative. I met this gentleman called Chris Byland. So when I spoke to him about the challenges that we faced as a community, he was very forward in coming out and telling me, you know what, I can feel the challenges that you are faced with. I am happy to work these challenges through with you. And since then, he has been bringing up a lot of support, being it funding, being it setting up an organization, a foundation project, whereas we could build a health center. Not only building the health center, but bringing up all the sustainable projects, whereas it will support the health center.
Mr. Banle also lamented that over the years, the community and surrounding villages have seen scores of livestock dying during the dry season due to a lack of drinking points. With the support of Chris Byland, 3 new boreholes were constructed for the community livestock and other purposes.
Just recently, we built 3 boreholes, and amongst these 3 boreholes, it has immense benefit to the communities. Because prior to these boreholes, we used to have a lot of livestock death during the dry season. With the help of these boreholes, this dry season, not a single animal has died. So you could hear according to what the families have been saying. So these are big achievements, and we understand that the government alone can't do it. So part of it, we thought, you know what, with the little we earn, we can then give it back to the community.
The principal nursing officer, who represented the regional health director, Sambaba, said the construction of a health center in Nyamanari is of critical importance as the area is within their catchment. He acknowledged that the nearest health facility to Nyamanari is Fatoto. Therefore, a health center in the community will be a significant milestone in reducing maternal mortality in the area and the country at large.
Health doesn't have a boundary. For us as Gambia, we know we are surrounded by Senegal in most of our areas. And if you look at it, most of our facilities are also receiving pregnant mothers and other patients from Senegal. So this location here is very crucial because it's going to help us. All those maternal deaths that are happening in the provincial part of Senegal, coming to our facility and they are registered here, is going to help us to reduce those deaths.
The regional governor Sambaba commended Alpha and Chris Byland for complementing the government's efforts in bringing healthcare to the doorstep of the people, disclosing that the government has injected a lot of resources into the health sector to boost national healthcare.
When you look at it, particularly on the side of what we call children and maternity, is something that also it has captured. So if this health post is completed, it is going to address the health challenges of this particular area, particularly the people of Nyamanar, where they have to trek from Nyamanar to go to Fatoto in order to at least visit the facilities over there. So if this is completed, then it's going to ease the burden on Fatoto Health Center, and at the same time also is going to open up the border, because from the statements that we had, you realize that within this area, the people of Nyamanar are the same people who are living within the other side of the border in Senegal. They are all relatives, they are all one. So it's going to make sure that it uplift what you call the health condition of the people within this area.
Strategically located at a crucial border entry point, the project is a massive venture that will serve as an early warning center for the detection of disease outbreaks. Alpha Balde and his partners are also working to support the community with a livestock scheme enabling an adequate water supply during the dry season, as they unveiled 3 boreholes constructed as drinking points. Seydou Camara, reporting for GRTS News from Basse Upper River Region.